I'm Secretary JudyAnn Bigby from the Executive Office of Health and Human Services for the Commonwealth of Massachusetts. There's a great opportunity because of federal stimulus funding to really bring the healthcare industry up to the 21st century by furthering the use of health information technology. And our goal is to make sure that everybody knows that that opportunity is there, and to make sure they understand some of the goals that the federal government has for this and some of the pitfalls for making sure that we don't waste the opportunity. In Massachusetts, everybody knows we've achieved near universal coverage with 97% of the population with health insurance, but we still have to work on 3 areas, and that is ensuring access to care, making sure that the care is of the highest quality, and we have to control costs. So one of the other things we want to do in this conference is talk about how health IT is a means toward achieving those 3 things. We're also very fortunate to have Dr. David Blumenthal, who is the director of the National Office on Health Information Technology. And from Dr. Blumenthal, we'll hear about the federal goals and how states can align their own goals with the federal government so that we make sure we take the biggest advantage, as I said, of this opportunity. We also have thought leaders like Dr. John Halamka, who is a local physician who has been incredibly important in advancing the use of health information technology and making sure that the standards that we're going to be using as we move forward with this work to make sure that various systems can talk to each other and can share information. So those are some of the leaders that will be at the conference. We would love to hear from individuals who have ideas about a couple of things. Number one, as I said, health IT is a means, it's not an end. So how do we make sure that we don't simply drive up the cost of healthcare, because technology is expensive, and I would hate for this to become the next healthcare cost driver. So how at the same time do we implement information technology to use to provide better integrated care, coordinated care, and drive down cost, but make sure that the actual cost of the technology itself doesn't drive up healthcare cost. Another issue that I'm very interested in is how do providers in non-urban areas where they might be practicing in groups of 1 or 2 or 3, how should we pay attention to implementing health information technology for them? What is the best way for them to take advantage of this technology and to make sure it furthers their ability to, as I said, ensure access to care, improve quality, and hold down their own costs? So those are some of the things I'd love to hear from the general public about. We're very focused right now on how we contain cost of healthcare in Massachusetts. We are very focused right now at reforming the healthcare system and using payment reform as a way to incentivize a better organization of healthcare. Health information technology is going to play a huge role in that, and as we begin to look at system reform and payment reform, we will be laying out a strategy that health IT can help with that. Well, we think this is a great opportunity. One of the things that I think is difficult for many areas where jobs are disappearing is that those jobs that are leaving are jobs that perhaps were outdated and not forward-looking. Implementing health IT in a broad sense across the entire healthcare system is going to require thousands of people working from everything from supporting healthcare providers with their technical needs in terms of hardware to developing new software, better software that helps providers deliver better care, to managers who can help healthcare providers develop these systems and make sure that they're working, to individuals who will be helping the state with building a health information exchange. So there are many, many jobs that will come out of this effort, and I think it's very exciting. These should be really good jobs. We'll need people to train people and to make sure that we've got quality assurance, so there are lots of opportunities here.